At the beginning of the pandemic, infections among children weren't necessarily a major concern. They were thought to be carriers of the disease, but not subject to actually getting the coronavirus by and large. Fast forward to now, we're almost in the third calendar year of the pandemic, and the picture is changing. The number of childhood cases is exploding, even though the variant causing the spike is said to be more mild. Here to help us understand what is going on is Dr. Dean Blumberg, pediatric infectious disease specialist at UC Davis. And Doctor, good morning to you. We need your knowledge.
Good morning to you too.
We've all heard so much about how Omicron as a coronavirus variant is much more mild than Delta, but hospitalizations accelerating to record levels with it, and that's happening with children especially. So how is it a variant of lesser concern but seems to be having more devastating effects for different groups?
So the mutations result in it being more transmissible with higher concentrations of virus, and that means that people are going to transmit to each other more. So it's somewhere around 3 to 5 times more transmissible than Delta. And even though it causes about 50% less severe disease, less hospitalizations, because there's so many more cases, this is resulting in more hospitalizations and more deaths due to COVID.
Alrighty. The number of American children hospitalized with COVID-19 recently hit a record high when compared with any other point during the entire pandemic. Between the 6th and 13th of this month, school-aged children made up 21.4% of reported positive cases in the U.S., according to the CDC. In California, the State Department of Public Health tells me the number of pediatric admissions because of the virus has more than tripled since December 27th, less than a month, from 31 then to 104 on January 13th. How worrisome is this?
Well, it is worrisome. In the U.S. as a whole, more than 10 million children have been infected since the beginning of the pandemic, but 2 million of them have been in the past 2 weeks, so it's really accelerating. And there's a couple reasons for this. One is that for the youngest children, those less than 5 years of age, we don't have vaccine available for them yet. And for children 5 to 11, we only had a recent recommendation for immunization. And so for those children, our immunization rate is relatively low. Only about 38% of those children have received 1 dose of vaccine. So we have a better immunization rate for the teens, for the 12 to 17-year-olds, over 85%. So we're not seeing as much in that age group, but more in the younger children. And then an additional complicating factor is that the youngest children, those 5 to 11 years of age, are at the highest risk of getting MIS-C, the multisystem inflammatory syndrome in children. That follows infection by 2 to 4 weeks. So that's an additional worry that we have.
My goodness, and you're talking about those that aren't yet able to be vaccinated. We've heard from Dr. Fauci that he hopes that that will come next month, but you know, there's some scuttlebutt obviously about that and when that may come down. Some experts say there's reason to believe that Omicron acts differently in younger children, that it attacks the upper airways more than the lungs. In children, those upper airways are smaller and thus become overwhelmed more easily. With what you're seeing, do you agree with that assessment?
Yeah, absolutely. We've got some laboratory evidence that the virus does multiply more in the upper respiratory tract. So about 70 times higher concentration versus Delta, but 10 times lower concentration in the lungs themselves. And so this is resulting in children being admitted for things like croup or bronchiolitis rather than in the past what we were seeing was more pneumonia. So we're not seeing as the severe cases of pneumonia that have to be in the ICU and often on life support. The admissions we're seeing in children tend to be more mild now.
Okay, and we know that what's gone into the current vaccines for minors has been a reduced dose from what adults are given, but in trials, Pfizer has at least reported that kids 2 to 4 years old don't seem to be having a strong enough immune response to just 2 doses. So the company switched over to a 3-dose test regimen. We know it's a challenge to get people to come back for their second vaccine dose. Is it wise to possibly be having parents bringing back multiple kids for 3 shots? Why not just keep the protocol 2 shots and make those shots stronger?
So the preliminary small study suggested that 2 shots with 1/10 the adult dose would be appropriate for this age group. And it worked just fine for those 6 months to 23 months of age. The immune response looked very strong. But for those 2 to 4-year-old children, the immune response were suboptimal. They weren't as high as what we were seeing with the older children and young adults. And so because of that, they went back to the drawing board and basically had 2 choices. One was to get a better immune response, to give a bigger dose or an extra dose, and they decided to give an extra dose. So we'll see how that works. We haven't seen the data yet, but hopefully that'll result in a better immune response, and so the children will be better protected.
So interesting that 2 dose is working for the littlest ones and then the next age group, but not the 2 to 4-year-olds. So much left to understand about this virus. Thank you so much for coming in to help educate us this morning.
Thank you.